Time now for Restoring the Soul of Healthcare from the HELPcare Clinic in Austin.
And as always, on a Thursday, very glad to have with us here for Restoring the Soul of Healthcare, Dr. Dave Strobel and Lee Aase. Gentlemen, good morning.
Well, good morning. Ordinarily, I'd be joining you from our HELPcare Clinic offices in Austin, and Dr. Dave would be just down the hall to prevent feedback from our microphones. But today I'm calling from my hospital bed in Rochester, where I'm going to be having neck surgery sometime later this morning or early this afternoon, and that story of how that all happened is kind of an illustration of something we wanted to emphasize about how at HELPcare Clinic we're providing primary care. We're providing a pretty comprehensive level of primary care, but there's some things that can't be done in the primary care setting, but doing primary care well can put us in a position to get the timely access to the specialty care when we need it. So I'd kind of like to have Dr. Dave talk a bit about, sort of what happened here, but also how this works in terms of getting the referrals into Mayo or elsewhere, depending on where people want to go.
Sure. So the story with Lee, and of course he's given permission to talk about this because this is protected health information, but the story with Lee is that a few months ago, he and I took a trip to Texas for a conference, and a little bit before that, he had noticed that he was having some numbness in a thumb and had some neck pain, and saw a good chiropractor that we work with a lot, and was doing some traction things and doing some physical therapy, and I used some medicines to help out with that. And it just kind of gradually settled down and mostly did quite well. But then later on, not fairly recently, last week or two, Lee had mentioned to me, it's like, I'm kind of having a little trouble with stumbling a little, and I'm having more numbness in my thumbs and both sides, and my neck doesn't hurt anymore, but this isn't right. I'm having difficulty walking up steps, and I just feel unsteady, And so I said, that's concerning. I think we need to look into that. And so he and I worked together, and we got him an MRI scan, and we used a service up in the Twin Cities that basically takes cash-only payments and makes it really very inexpensive compared to a lot of places. And he got that MRI scan done on Tuesday, and they did a very good job. They produced very good images, and we knew about the results later that same day. And then I was on my way back from the Twin Cities, where I work on Tuesday, driving back, and Lee and his wife Lisa and I were on the phone while I was driving, hands-free. I was doing this legally, but we talked about the results, and I said, well, this is quite concerning, because he had a disc in his cervical spine and several other things that were causing some pressure on his spinal cord. Now, if that is severe, that could be really dangerous. That's the kind of thing that causes people to not be able to move their arms and legs and be paralyzed and in wheelchairs and all that. But this was a gradually progressive thing that was just slowly starting to produce symptoms. So I said, this needs to be evaluated by a neurosurgeon. And we were going to look at different places that we could do that. And we looked into some of that and said, I think I will. I'll just work with the Mayo folks. And so on yesterday morning, I got referral stuff sent in to our Mayo colleagues, and then Lee heard back from that office, and I said, well, this is quite urgent. Please get going. Wasn't quite to the point of go right to the emergency room, but we had considered that. And they got back to him later that morning or shortly afternoon or something like that. And it was going to be a little bit of time. And then talking with them again, they said, why don't we just have you go through the emergency department at St. Mary's? So they went to the emergency department. They were evaluated there. The ER doc was very glad that they came. He, I believe, said, "Dude, I'm glad you're here." And he was evaluated by neurosurgery, and they said, "Let's get going with this. Well, if we want to wait, we don't need to. I think it's good to get going." And so Lee is scheduled to have a corrective surgery this morning or this afternoon. And if all goes well, which we really expect it to, he may be back in church on Sunday. So I'm hopeful that this will work. But it was just really good example of working with different places and getting things done as quickly as possible.
Yeah, and I guess we hear sometimes we get questions from people saying, well, can I still go to Mayo if I, have a membership at HELPcare Clinic and I'm not getting my primary care there? And from my previous experience working at Mayo, I worked there for 21 years. One of the things I knew is that about 75% of patients who come to Mayo Clinic are coming from more than 120 miles away. So they're all getting their primary care someplace else, and they're going to Mayo when they need the more specialty care, which is what I'm getting right now. And I have to just say we've seen the hand of God in this movement and being able to have this move as quickly as it has. We can't say that it would always go that quickly. That Tuesday I got my MRI. Wednesday, Dr. Dave made the referral, and by a little after 5 o'clock, Wednesday evening, I was scheduled for surgery today. So it isn't always going to happen that way, but having a good system in place, and I just really credit Dr. Dave with his sensing that we ought to get some good imaging. We get those MRIs, and we were able to get them at a much reduced rate. But because I was able to bring them on CD with me to the emergency department, they were able to get them uploaded. They said they were good quality images. They didn't need to do them again, and that based on that, they could make a quicker decision. So having a good quarterback for the process. I know Dave's not a big sports guy, but having somebody
I don't even like
really
baseball.
directing it really made a big difference. So we're really grateful and hopeful that things are going to work out well. And I also am just grateful. I mean, we having one of the best orthopedic and neurosurgery centers in the world that's 40 miles away from us is just a real blessing as well. And my personal familiarity here too. It's great to be able to do this.
Right. So HELPcare Clinic, can't do everything, and we won't. But we want to work with folks that can help us out. So the important thing is that we're gonna handle a lot of things in this clinic, but we won't handle everything that every primary clinic handles, because not every primary doctor feels comfortable with every single thing that other primary doctors feel comfortable with. But we can handle a lot of things, but I'm not going to handle this. I'm going to arrange for folks that do this for a living to take care of the problem. So it's a matter of working together with patients and just making the right referrals. The timing isn't always going to be this good and everything, but it's just a good example of how our model allowed me to be able to take care of this quite quickly as well, because we take time. We have time to be able to do that. It's not a constant rush for me all day long, and that allowed me to really take the time and get things going in a hurry, and that does help facilitate this kind of thing. So I think that our whole model makes it easier for this to go quickly.
I did a blog post about my experience last night while I was in my hospital bed here in Rochester. They had good Wi-Fi and everything, and so I was able to do that. So I'd encourage people to go to healthcare.health, and they can kind of see more about what went on with this story. But also then just the general application is that, by having a membership with HELPcare Clinic, you get that personal level of care of somebody who knows you, who you know, a consistency of care, and then being able to, when things need to move more quickly because of a more serious situation, to get the right referrals made to get the treatment that's needed. And so if people would like more information, again, please go to HELPcare.health. Give us a call at 507-279-2345. Somebody else will be answering that today, by the way. Or stop by to visit at 308 4th Avenue Northwest. We're just a block east of St. Augustine's and right by the Hormel Historic Home. So we're really grateful for how this is all working. I'm expecting a good outcome here and feel like we're in really good hands, and especially the providential hands we've been in making this all happen.
I was just going to add, if I could here before the end, Lee, first off, best of luck to you on your upcoming surgery, and I guess secondly, that kudos to you for being proactive in your health care. That that a lot of people, including myself, are if something might pop up. It could be this or it could be that, but I'll be okay, or it's nothing or whatever. But obviously that wasn't the case here. So kudos to you for being proactive in your health care. Something that a lot of us could learn from.
Yeah. Well, I also have a very diligent wife and concerned wife who says, you really ought to talk. And she made sure that she mentioned it when I had the little episode, that she made sure to mention it to Dr. Dave.
Sure.
And he said, you need to talk to Lee about this. So
sure.
It's a team. It's a team.
Yeah. Well, again, best of luck to you on your surgery coming up here today, and it's a great thing that sounds like we'll be able to, of course, talk again here next week. We'll be talking with John, but as always, great stuff for us, and again, best of luck in your surgery here today.
Marvelous to talk to you, Jason.
Great to be with you.
Take care, you guys.
Take care.
Yep.
Blessings.
Okay. All right. Again, Lee Aase and Dr. Dave Strobel, and our Thursday 10 at 10 feature, Restoring the Soul of Healthcare.